I'm a filmmaker based in Doncaster, and in 2022 I was granted access to film and interview those working at the detox clinic on Bolby Road. I met with Stuart Green, the service manager of Aspire, the umbrella organisation that New Beginnings sits under, a partnership with the Drug and Alcohol Service and the NHS.
So there's quite a lot of work going off at the New Beginnings. This side we converted a lot of years ago now, and to increase it to 10 beds, and where we're up to now is we're just about to add a couple more. We've got a carpet going down with you. A lot of time, inpatient detox hasn't been in reach for a lot of people. People who end up detoxing in hospitals, it's the wrong setting. That's for acute and emergencies. Some people have obviously got some significant issues. Where we can get upstream of that and plan and get people in, we stand a better chance of improving outcomes, reducing health inequalities, taking risk out of the equation, and taking pressure off our acute colleagues in hospitals. People respect the environment that they're put in. We show respect, and it's reciprocated back. And it's clean, tidy, modern, discreet, comfortable. We give people a sense of, empowerment, so they cook for themselves. We don't cook meals for them. This is all about changing life behaviours. This isn't a hotel, but it isn't a boot camp either. So these are the people that have succeeded. It's one of the hardest handprints you'll ever put on a wall to achieve. It don't come easy.
I asked those who had experience with addiction to describe addiction in their own words.
I don't think you can define it. That's my opinion. I don't think there's a definition. There is no black, white, whatever. It can come in all shapes, sizes, forms. It can happen for reasons. It can happen. My experience, trauma, domestic violence. Lots and lots of things can happen.
For addiction, you're fighting a constant battle in your head. So I suppose it could be put down to mental health. For me personally, it is.
Yeah, it's fine, be all right.
Yeah, I only live in Harworth.
Oh yeah. Well, I went through rehab back in 1999, and it was in a place called Crescent House. It's actually closed now. It was Richmond Fellowship, and it was in Notting Hill. And it was funny because the day I arrived, it was Notting Hill Festival, and they'd drawn all the curtains to stop us from being tempted by the jamboree or whatever else. Sick of being sick is the saying they use, but I just felt so unwell. The drugs stopped working. They stopped doing that effect of whatever you do. There's only ever two reasons why people use. That's either the buzz or avoidance. The buzz soon goes, and then it's generally avoidance, putting off the inevitable or the pain. People have a gratitude around life, and people are grateful for their lives generally. But people in recovery have an added amplification. It's almost like it's like a rebirth kind of feeling. But the bottom line of it is that in recovery, I think you either win or learn. There is no losing.
I took a trip to Roslin House in the centre of Doncaster, Aspire's central hub. This is where Stuart works, managing a team of over 100 staff across 8 sites, who support in excess of 1,600 patients.
I had to put all the AMPR up because we're just getting loads of people parking going to town, and I thought I had loads of staff and I didn't. I didn't have any parking either. For some people, it's what a bit of advice. It's not a full-blown structured intervention like similar to New Beginnings. It may just be a bit of advice, and you can see on the board here, we're looking at toolboxes and strengths and how you can help yourself, so it's very much softer, more drop-in. How can we help you, not what do you want? And I think it's a very transactional. When you look at substance misuse, it is very transactional. Addiction is, you give money, you get drugs, you take those drugs, it works this way. People know exactly what they're getting, and it's very, whereas this is more unconditional. You're coming in, right, have a seat. Yeah, okay, what brings you here today? This is an example of the timetable, and what we've got here is we've got Mood Masters, which is for kind of low-level mental health. So Focus on Recovery gives people the tools and the skills to start to identify, where are they in wanting to change the behaviour. When you look at Maslow's hierarchy of needs, one of the key bits is safety, warmth, security. Without housing, how can you start to work with people? You know, if you're street homeless, no wonder you're taking drugs. So there's a bit on relapse prevention. You say, well, why are you giving people relapse prevention before they've stopped using? Well, if you teach someone to drive, why are you teaching them to use the brake before they learn the accelerator? It's about actually preparing people to understand, you know, how stuff can go wrong. All the way up to the top, Raj.
No worries. Oh, blimey, it really is.
I know. So that's a pictorial impression of the services. That's the way in. That's New Beginnings. I've got hubs at Mexborough, Jade and Stainforth. We've got a court service down in the cells. Jim, do you want to be on camera?
No.
Go on, go for it.
Yeah. Didn't need leg change.
Yeah, then that makes up for you not winning.
Yeah, forward mental health.
I've got a caseload of about 40 clients who I see on off. We do psychosocial intervention, which is like a bit like counselling sort of stuff. Then we also do the opioid replacement treatment, medication, harm reduction, needle exchange. As you can see, this is an integral part of our service. You know, it's the first point that maybe a lot of our clients have ever come into. So it's like we can encourage them, we'd like to get into service, which we do. And at the same time, give them harm reduction advice.
So needle exchanges sort of came about when the AIDS epidemic started. So very quickly, the UK made a decision to put needle exchanges in. But then very rapidly, just like what Jim was saying, is people were coming in and saying, I want help, I'm fed up with this lifestyle. So the explosion in drug treatment then followed, because what they realised is people were coming to needle exchanges and wanting to do something about stopping.
A bit of despair and pain and consequence and suffering and degradation, loss, grief, shame, guilt. You know, you could keep going on with all them negative emotions. That's what addiction was for me.
How you doing, Stu?
Yeah, good are you? Addiction is a long-term health condition, and some of the consequences of that, unfortunately, is hepatitis. So on World Hepatitis Day, nationally all over the country, events like this are happening, and it's just an opportunity to really kind of focus on some of the wider impacts of health. So that's kind of why we're here today, and the team have done brilliant today.
So what we've seen is the symptoms that people suffer from. When we give them the treatment, and the treatment's successful and they've taken it, they start to feel better, both physically, mentally, spiritually, and then they're saying to us, I want recovery because I don't want to go back to that lifestyle. I feel better because the mental health's improved, because the body's not fighting the virus anymore, so it's got time to recuperate itself. The energy levels increase, the mind increases and gets better. Physically they get better. So then it's a springboard to recovery, springboard into life itself.
I'm not ashamed to admit that I'm an alcoholic anymore. I've been addicted to alcohol for years. I never admitted it, but it's been my partner that was the main thing for me. She was pushing me to get help, and I was like, I don't need help. But just taking that first step is in itself, that is an achievement, just to ask for help. And by doing that, there's so much more to be had from Aspire and New Beginnings. It's once you've done that first hurdle, it's kind of all the help's there for you, changing your way of life to be that better person.
When you're talking with another addict, somebody who, you know, identifies as an addict, so, you know, being sensitive, growing up, being a bit shy, being overwhelmed by things, that's all very normal stuff. You know, I've got kids, one of them is quite like that. I think the people that I meet in the fellowships, that's kind of over amplified. So, you know, maybe that is an element of being an addict, of addiction. That was certainly my experience growing up.
So at New Beginnings, obviously, it's medicated detoxes, so we're clinically led. I manage the group of Band 5 nurses and support workers that are here. And so they do the medication rounds, risk assessments, the care plans, the day-to-day nursing care of the patient. So if they've got mobility issues, the care there, wound care, the injections, and if they need bloods doing and ECGs and stuff like that. So all the clinical side of nursing.
Work long days, so we start at a day shift, 7 in the morning till 7:30 at night, 12 hours, 12.5 hour shift. So come on in the morning, make sure everyone's all right, say good morning, and then do morning medication about 8 o'clock in the morning. Have a meeting with the patients, the client group, see what people are doing for the day, who's going to do the cooking, that's a big thing.
We want to have nutritious meals, staff will support them to cook. But, you know, often people come into addiction and a nutritious meal is a can of pop and a Mars bar. So actually getting some understanding about nutrition, because you are what you eat. I know it's a bit of an old chest, but you know, you are. So we provide all the food, and it's quite a challenge cooking for a group of people. But equally, there's something about that experience of eating together, which people really value. And what, you know, often people come in and they say, I'm not really stuck on groups. Well, actually, your first group is actually looking at what the menus are and planning. Suddenly you're involved in a group activity without realising it. I don't know anyone that's gone into recovery on their own. I know people that come to, someone's always been instrumental or helped or supported, peer support, workers. It's an illness or a disease which needs support.
They experience a lot of prejudice. Even, I have to say, from other healthcare professionals. You know, if you're a drinker or a drug user, then you tend not always to be taken very seriously, no matter what the problems are that you have. So, you know, we go out of our way to treat our patients with basic human respect, and they respond very well to that, don't they? So.
And for me as a staff member, it's somewhere that I've always, I'm not just saying it either, like since the day I started working here, when I come through that door, then you just feel it is a happy place to be. And most staff members feel like that. And when I said last place where I worked, where I was going to, what are you going there for? You know, I think there's a lot of people that are uneducated around the drug and alcohol service, really. And what kind of people do need our help. Professionals like ourselves, we've got nurses, doctors, teachers, professors, we've had everything coming in our doors, you know, to do a detox.
Well, there's a very high correlation with trauma, childhood trauma, very high correlation. It must be well in excess of 90%, if not just about everybody, I would say, because I've always been convinced that you know, of the people who deny that there's been childhood trauma, there is a sizable minority of them who are denying it themselves and just don't want to go there. So there's very, very high correlation. And the stories that you hear from patients, if you put yourself in their position and think, if I'd been through what they've been through, would I have ended up in a different place to them? And the answer is probably not.
I mean, today I've been longer in recovery than I've been in active using, which I find fascinating in itself. But then that active addiction's made me who I am today. What I feel was missing, because I had a good childhood, a lot of things were really positive. I can't pin it down and say this was the cause of it. But throughout school, no one ever taught you about feelings. No one taught you about kind of empathy or, you know, being allowed to feel, because a lot of people react on feelings, you know, and you see it even in recreational alcohol use. People celebrate with alcohol, people use alcohol and they're depressed, and it's a logical response to an unhelpful feeling, and for some people they get stuck in that, and I was stuck in it. Some people will use stuff and then move on and they get over it. Some people get stuck and never move on. And then I think that's when it becomes a downward spiral.
Addiction to me, I mean, in one word would be would be prison, an internal prison, being locked. You with me? Being what's the word? Being trapped. You with me? And then recovery turns into freedom, and the way out of that.
Recovery Games is an event that takes place every year, and it's an opportunity for people in recovery from addictions from across the country to meet and compete in a day full of fun challenges.
It's competitive teams, up to 22 teams of 10, bring supporters. It's very sportsmanship. It's a bit like It's a Knockout and Tahitia's Castle, loads of coloured paints, activities, fun. The last time, just before we went into the pandemic, 1,000 people from all over, England, Wales, Scotland. I think it's just a really visual display of what recovery and well-being could look like. But the guy that does Recovery Games is here, Reg, and he always loves the camera.
So New Beginnings is really kind of the birthplace of the Recovery Games. This is where I was placed, and that's where all the ideas sort of came from, working with the groups of people that we did do here. And it's just grown and grown from there, really. So we do actually have a bit of a showcase here again. So this was from the very first ever Recovery Games, so 2013. Checked registrations this morning. We've currently got 32 teams registered from all over the UK. We had a guy that actually he did his inpatient here. He did the structured day programme. He relocated to Scotland to rehab, and then came back as part of their team. He sold the Recovery Games to them.
When you do something that is attractive, and it's about the same as putting drugs and alcohol down, if you've got something that's worth doing, that naturally gets put down. You're winning straight away.
A lot of my spare time is used. I sleep very little during this process, but it all pays off. And on the day, it's just once it's started, everything's set up. Is when I sit back, I relax, and I just watch.
Whoever said you can't have any fun without drinking drugs, they were lying. Best thing that ever happened to me was recovery. I've been over 12 years clean now. I've been all around the world. I couldn't get off my estate. You hear me? I couldn't get off my estate before I got clean.
The visible recovery element of it is important because it shows that recovery works, and it doesn't just work for an individual, it works for hundreds, thousands, millions of people. It's there if you want it.
Been really good spirits here, been great. Community's massive.
Well done, mate. I'm good. How do you feel? You're knackered.
Absolutely. It's done. Loads of great feedback. Loads of happy smiley faces. That's what does it for me. No complaints. Not from me or anybody that's came. Day's done. It's a wrap.
Nice one.